Hello friends, welcome to Mock Test channel. In this video, we'll be covering EFA Exit Exam questions with their answers. If you find this video helpful, please make sure that you press that thumbs up button and also press on the subscribe button below. Now you may wonder, why would you ever press on a subscribe button on a mock test channel? It's going to be of no use after you clear the exam. But let me remind you that there's a lot of efforts that goes into making these videos, and if you find this effort worthwhile, please press that subscribe button as a kick of motivation so that we could create such useful contents in the future. Question number 1. What is first aid? A. Completing a primary serve. B. The first help given to the victim of accident. C. Assessing a victim's vital signs. D. Treating a victim for shock. And the correct answer is B. The first help given to the victim of accident. Question number 2. If a known epileptic is experiencing a seizure, you should A. Restrain them by holding their shoulders. B. Call an ambulance. C. Place a pillow or towel under their head and feet. D. Remove furniture or other close objects. And the correct answer is D. Remove furniture or other close objects. Question number 3. What is the primary purpose of splint applied in the first aid? A. To control bleeding. B. To reduce pain. C. Immobilize a fracture. D. Reset the bone. And the correct answer is to immobilize the fracture. Question number 4. Flanges making up the fingers are composed of A. 12 bones. B. 13 bones. C. 14 bones. D. 15 bones. And the correct answer is C. 14 bones. Question number 5. What are the lumbar vertebrae found? A. Comprise 2 bones that come after the thoracic vertebrae. B. Comprise 3 bones that come after the thoracic vertebrae. C. Comprise 4 bones that come after the thoracic vertebrae. D. Comprise 5 bones that come after the thoracic vertebrae. And the correct answer is D. Comprise 5 bones that come after the thoracic vertebrae. Question number 6. When contraction occurs, blood passes through A. Capillaries. B. Arterioles. C. Veins. D. Aortic valve. And the correct answer is D. Aortic valves. Question number 7. The sideway movement of the trunk at the waist is called A. Lateral flexion. B. Abduction. C. Gliding movement. D. Angular movement. And the correct answer is A. Lateral flexion. Question 8. In the relationship of parts of the body to each other's, superior means A. In the back of. B. Towards the feet. C. In front of. D. Towards the head, end or above. Correct answer is towards the head, end or above. Question 9. How many layers or tunics does a artery have? A. 4. B. 3. C. 2. D. 1. Correct answer is B. 3. Question number 10. The immune system fights against A. Destroying of healthy cells. B. Internal changes of cells. C. Introducing infected cells. D. Infective organism. Correct answer is B. Internal changes of cells. Question 11. Which of the following is the digestive system disease? A. Cholera. B. Diphtheria. C. Smallpox. D. Typhoid. And the correct answer is A. Cholera. Question 12. The spinal going down is divided into how many divisions? A. 2. B. 3. C. 4. And D. 5. Correct answer is C. 4. Question number 13. Which statement about a simple sling is true? A. The part of sling against the chest goes over the shoulder or the injured arm. B. The pigtail protect the neck from injury from sling. C. The injured hand should be 4 to 6 inches higher from the elbow. D. The part of the sling furthest away from the chest passes over the shoulder on the injured arm. And the correct answer is D. The part of the sling furthest away from the chest passes over the shoulder on the injured arm. Question number 14. What is the proper treatment of the heat stroke? A. Rapid cooling of the body. B. Covering with a blanket. C. Exercise. D. Drinking alcohol. Correct answer is A. Rapid cooling of the body. Question number 15. Treatment of sunstroke principally consists of cooling, removing of shaded area and lying down. B. Bathing with rubbing alcohol. C. Drinking ice water. Correct answer is A. Cooling, removing of shaded area and lying down. Question number 16. Which is the first step in the chest compression for infant? A. Place the middle and index finger on the breastbone. B. Place the index and small finger on the breastbone. C. Place the heel of one hand on the sternum and heel of the other on top. D. Place the heel of one hand on the ribs and the heel of other near the first hand. Correct answer is place the middle and index finger on the breastbone. Question number 17. Airway obstructions defined as A. Failure of air entered in the lungs. B. Failure of breath. C. Block in the passages of air in the lungs. D. Breath holding. Correct answer is C. Block in the passage of air to the lungs. Question number 18. How will you give rescue breath to casualty? A. Mouth to mouth and nose respiration. B. Mouth to nose respiration. C. Mouth to mouth respiration. And the correct answer is C. Mouth to mouth respiration. Question number 19. To treat a person suffering from heat exhaustion, you should A. Administer artificial respiration. B. Put him in a tub of ice water. C. Give him sips of cool water. D. Cover him with a light cloth. Correct answer is C. Give him sips of cool water. Question number 20. Anaphylaxis is treated with A. Analgesic tablets. B. A tablet under the tongue. C. A EpiPen injection of adrenaline. D. An injection of insulin. Correct answer is option C. A EpiPen injection of adrenaline. Friends, hope you found this video useful. Make sure that you watch the next part too.